malaria and homeopathy go synonymous. In fact, homeopathy started as a discovery only after the medicine for malaria was first tested by Dr. Samuel Hahnemann when he was translating old Materia Medica. The first medicine that was actually which raised his curiosity about its action was cinchona bark, which was a medicine for malaria at that time. So homeopathy and malaria grew together in the sense the medicines for malaria. But from that time till now, things have changed quite a bit. Now when we see cases of malaria, which in our tropical countries are so much rampant that it is like in every third or fourth patient during a rainy season that walks in with a malarial type of fever. And with the increased sensitivity of the modern medicine towards the human constitution, the patient's reaction to the medicines are sometimes so adverse that they have to resort to homeopathy. So for us homeopaths, this has become challenging and rewarding too. For example, how do we see a case of malaria differently than what an allopath sees? Actually, it is nothing different. Fever with chills and the evening rise of fever with a blood test coming positive for malarial parasite is simple as what anybody else knows in cases of malaria. But when we see a patient of malaria, apart from the typical symptoms which any other physician would see, we see something which is very individualistic of the person. It can be the pattern of fever, it can be the chills of the fever, it can be the periodicity of the fever, it can be something that comes and goes along with the fever, or even the change in the patient's mental state at that time. When we find something unique about the patient which is different than the regular pattern of the fever, we nail that symptom down and try to search the medicine in the whole of the vast array of medicines that homeopathy has. What we have found as an experience is, if everything is matching fantastically, the patient responds well. My clinical experience I would like to share is, some of the patients whom we treated for malaria recovered so fast without any lingering even after effects like the weakness and the malaise that stays even after the fever recovers. I still remember a child who was brought to me with a malarial fever 104, and he was actually in a torpor state where he was not responding, not even opening his eyes when he was approached. And he was about to get admitted when I saw a typical behavior when I touched him. And this behavior was so unique and uncalled for in the state in which the patient was, helped me to come to a medicine which, after giving, within 24 hours, the patient's spike went off and did not require any other medicines for recovery. His admission was saved. Within 24 hours, the patient started gaining his appetite, and within next few days, he was better. This is an example that happens in our clinics now regularly, because we have advanced ourselves trying to understand fevers better, the pattern of the fever better, and giving results consistently. Now, if there are so many cases which are already on treatment with modern medicines, good, very nice. But if the patient is not responding, it can be combined with homeopathy without any side effects, so that both of the systems can work together to give a better recovery and lesser side effects. How do you sum up this? In today's world, when malaria is so rampant, especially in our countries, and we really need to fight so that our next generation doesn't get into this mode of affection every time, we need to combine and join hands together and understand the efficacy of homeopathy and use it as a first shot medicines in most of the cases. If not, even it can be combined with the modern medicines to give a fantastic recovery.